My name is Dr. Meghan Denney from Paws at Fulshear Veterinary Clinic, and today we're going to be talking a little bit about kitten vaccines, cat vaccines, and kind of when to give them, why we give them, and I'm going to have one of my veterinary technicians asking some questions so we can run through, and hopefully this will help you get some more information for you guys.
All right, Dr. Denney, what are non-core vaccines for kittens and why does my kitten need them?
So we have core vaccines. So we'll talk about core vaccines first before we talk about non-core. Core vaccines are considered like what is the most important thing for your kittens, especially in the United States, to be vaccinated for. What are the most common diseases that we can prevent? So the first one, of course, is rabies. Rabies can be given starting at 13 weeks and then needs to be given once a year thereafter. Rabies is transmissible to people, so that's another reason why it's so important. It is 100% fatal to animals, so it's super important. And even if your cat or kitten doesn't go outside, it's super important just because things can happen. Like here in Texas, we do have endemic rabies. Skunks can carry rabies and show no symptoms. And there was an instance even where a raccoon got inside and bit an indoor kitty cat who ended up having to be put down because that raccoon did carry rabies. So fluke things happen, and it's super important to follow. It's also Texas state law. Non-core vaccines would be something like feline leukemia. So feline leukemia is known as the kitty loving disease because it's transmitted by cats through grooming and loving on each other. It's usually very much fatal as well. We recommend it for cats that go outside and are having interactions, but if they're indoor only, they're a little bit low risk. Going back to another core vaccine that's super important is our FVRCP, which is basically the feline upper respiratory viruses that can be really detrimental to their health and can create emergency situations. So just like we get vaccinated for the flu, or some of us get vaccinated for COVID-19, FVRCP is considered core vaccine because it is one of the most common transmissible disease with kittens.
How soon should my kitten be vaccinated?
So we like to start kitten vaccines between 7 and 8 weeks of age. You can start them around 6 weeks. I typically like to wait a little bit longer just because the maternal antibodies are really still hanging around. And then once you start your vaccine, you give it every 3 to 4 weeks up until the kitten is 16 weeks of age.
What is the recommended vaccine schedule for kittens?
Every 3 to 4 weeks up until they reach 16 weeks of age. That way we make sure we form lasting immunity to protect your kitten, and then it's once a year thereafter.
Does my kitten need vaccines if they're only going to stay indoors?
So they do, because viruses and bacteria are microscopic, and even if your kitten is not going anywhere, you are. And if you have dogs, they're going places, and things can viruses and bacteria can live on our skin and everything we touch and on our shoes. So you can infect your kitten even if they aren't going anywhere. So it's super important that for even indoor only kitty cats that aren't going anywhere to have their vaccines to help them stay healthy.
Are there any risks or side effects associated with kitten vaccines?
So they're usually very low risk. The biggest side effect that we can see is a little bit of pain when we're giving the actual vaccine. Nobody likes needles. There is a little pinch. They can be sore at that area for a few days after. Sometimes you can even get some swelling. It's very rare to see a true vaccine reaction, but if it is seen, generally the first sign that you're going to see is vomiting within about an hour or two after giving the vaccine. If that is seen, then they do need to come back to the veterinary clinic. Other vaccine reactions we can see is facial swelling or hives. Once again, they're very rare, but in that event, you do need to go ahead and bring them back to your veterinarian. And if your veterinarian's office is not open, please go to the nearest emergency veterinary clinic for care.
What if my kitten misses a vaccination?
So if your kitten misses a vaccine, then we come in when you can, and we kind of start where we left off. So say you get your first vaccine in 7 to 8 weeks, and then you miss your 12-week vaccine, but you come in for the 16 weeks. Generally, once at 16 weeks, your immune system is considered an adult. What we usually do just to make sure we've got enough protection is I usually will still booster one more time after that. So we kind of just pick up where you left off. The only exception to this is sometimes with older kitties that are maybe 1 or 2 years of age. Their immune system is an adult, therefore one vaccine should produce enough of an immune response to last for a year.
Can my kitten go outside if not all vaccines have been given yet?
So ideally no. Ideally not. We really like our kittens and cats to be protected when they're going out into the environment. You know, I can say that my cats aren't vaccinated for feline leukemia. They are indoor only. They don't go anywhere, but they do come outside, outdoors, out back with me, but I'm with them, and it's usually for short periods of time. My yard is fenced. There's no chance for them to have any interaction. Is that best practice? I should probably vaccinate for them. They only go outside maybe once every 6 months. But if you live in a highly populated cat environment where you have a feral cat population, yes, ideally you need to have your cats vaccinated for both feline FVRCP, feline rabies, and feline leukemia.
Why is it important to get my kitten vaccinated by a veterinarian?
So there's different types of vaccines. Not all vaccines are created equal. So if you go to a low cost or if you get your vaccines from Tractor Supply, we can't guarantee that the vaccines are, number one, stored appropriately. If a vaccine sits out for any longer than about 10 to 15 minutes, the vaccine doesn't always have as much of a response because the particles can actually start to die, so you won't get an immune response at all. You know, low-cost vaccines do have their place, but your vaccines given from a veterinarian, even though they might be at a slightly higher price point, you know that, number one, they're stored appropriately, they're given appropriately, because when you give your cat vaccines at home, you really want to make sure you're giving it in an appropriate time, place, and position on the body, and you don't want to do harm to your kitten. So while there is a place for that, I'm not a huge fan, just because we can see kittens that are not given appropriate vaccines, or if they're given a vaccine that hasn't been stored properly, you may not have any protection at all.